Hi, I'm Doc Edwards here with another One Belly, Two Brains Wednesday. And this video is for you if you have questions about who should be on your birth team when it comes time for your home birth. So I had the opportunity recently to take care of one of my patients at her home actually while she was in labor. I got called in by the midwife for a couple of reasons. I have a really good relationship with this midwife. We usually have agreements with both the midwives and with the patients that if they need us to attend their labors, that it's okay with them. So I came into this situation understanding what this patient's pelvis normally moves like, and we had recently done an assessment with her, so I had a pretty good idea about where things were balanced and where I may look for some places where things could be hung up. But I got a little bit surprised because she was having some pubic bone pain that I wasn't really expecting. And as I started feeling around, what I started noticing was that it wasn't necessarily her pubic bone itself, it was actually coming from her bladder. So she hadn't been having the ability to use the toilet, and so her bladder was really, really stuck. I found this one really personal to me because during my son's birth, a very similar thing was happening to his mom, where she ended up going through a catheter twice in order to be able to go pee. And while you're trying to labor, I mean, having that as a complication was excruciating for her and also for this patient. So one of the things that I did, first thing I thought of was the forward-leaning inversion. Now, if you aren't familiar with the Spinning Babies series of activities or with Carol Phillips' work with dynamic body balancing, let me first off refer you to them. That's where I did a lot of my training, was understanding things like forward-leaning inversion was by going through extra training. In fact, I'm a Spinning Babies approved provider, so here locally, that's something that's great for me, but I'm sure you can find somebody in your area. It doesn't necessarily have to be a chiropractor. There's a lot of other body workers who do this as well. A lot of doulas, a lot of nurse midwives, a lot of people can take the Spinning Babies training. So one of the things that I was doing was this forward-leaning inversion that I'll demonstrate to you. And it's important to understand that this is something that you can do during labor. I have my patients practice this. I have them do it as part of their just normal pelvic balancing activities that they're doing during the week. And with the idea that if they can get the muscle memory going, that really helps them when it comes time to birth to be able to get in this position that can be kind of awkward if it's your first time. When you go inverted, what you're going to do is you're going to work yourself down onto your elbows and you want your back as vertical as you can. As you're hanging out upside down, we need you to tuck your chin into your chest. What that does creates a good C shape in for your spine that will allow baby to move. When you get back up, you're going to put your hands down, and usually you'll have a partner to help you, especially during your labor. I really recommend that to help you get back up, and you'll sit back down in your sit bones. We have a video that we can show you this forward-leaning inversion. There's a couple tweaks that I'd like to make. Again, I really refer you out to the Spinning Babies website. They did an excellent job of demonstrating these techniques. So when we did the forward-leaning inversion during this labor, the idea here was that we needed to get baby up and lifted out of the pelvis so baby could kind of tuck the chin in, tuck the crown of the head into the cervix, and then spiral out. And so in order to accomplish that, we ended up having this mom doing this during her labor surges. So she was having contractions, we'd bring her upside down, and we did that for several of these. She was able to do about 2 or 3 contractions in a row before we get her back up and then let her rest for a little bit. And as she started having them again, we'd bring her back down inverted. The idea that both her and her baby were trying to work together. So the first time that I spent about a couple hours with her, it gave her a lot of relief. I did that, something called sideline releases. I adjusted her. I was checking things like the hypermobility that I saw just because I'm her chiropractor and I know that this was something she was dealing with. A lot of work really to help balance out her pelvis. Felt great when she left. Midwife called me several hours later. This time, what it looked like was that although she was 100% of face, she was 7 centimeters dilated, and she had a bit of what she called an anterior lip. I find out she still hasn't been able to use a toilet on her own. And so she had something when I saw her earlier where she had a spasm in a muscle we call the psoas muscle from her back on the right-hand side. It was really also giving me a lot of spasm in these ligaments that come from the uterus forward called the round ligament. I was having a lot of time trying to unwind that ligament, which isn't typical. This kind of presentation, I was wondering if we had the baby's hand, so we call it a nuchal hand. The hand was up by the face somehow, so put baby in correct orientation, it'd be like this. And if that was part of the problem. And when I saw it again, I started thinking, well, I need to address the fascia differently. The technique is called a leg unwinding. It's a cranial sacral move that I learned through Northern Lights Wellness. They are a group of providers, a midwife, Deb McLaughlin, and Adrienne Caldwell is a massage therapist, who help train providers, healthcare providers like me, to help take care of expecting moms during pregnancy and labor. Dr. Carol Phillips is the one who originated it with some of this cranial sacral unwinding. That psoas muscle, as I was doing the turning with the leg, was helping to somehow change the dynamics inside this mom so that baby started shifting. She started being able to have, she was able to pee, she was able to have a water break. When I was finished checking her, and again, I was looking at really deep sacrotuberous ligaments, really deep pelvic floor kinds of ligaments, really, intricate coccyx kind of moves, and it changed everything about her belly, changed everything about her pelvis. Things got going shortly afterwards. Baby was able to be born at home. As baby was trying to pass through, it's trying to come through the pelvis here, and as it's trying to rotate in and around, we ended up having a shoulder get it stuck. And I wasn't sure if baby was going to rotate this way or if baby's rotating this way. They can do both. They have a preference for the direction that they usually like to go. Most babies will move a certain way, but this baby actually had bruising on the right arm and right rib cage that I saw after the birth. So more than likely, baby was doing something close to this as it passed by the sacrum in through the outlet like this. And so as baby's trying to do that spiral, what I think was happening is that baby was coming at such an angle that the bladder that usually sits here was getting pinched off by that baby's shoulder. When we started doing the psoas release on this right-hand side, that allowed baby to get out of their way just a little bit to be able to continue to spiral and engage and then go ahead and be born several hours later. Who is on your birth team? If you're a first-time mom, like this mom was, and you expect a baby to just fall out of your body, what I've seen in my community is that we have a 1 out of 5 women who are first-time moms end up having a surgical birth. And the big question that drives me is always the why behind that. For these moms, what I'm seeing is that we've got some pelvic floor restriction, we have some imbalance in their pelvises, that chiropractic is excellent at addressing those subluxations and helping to balance that out. Specifically, perinatal chiropractors, like the ones that I train through the ICPA, get a lot of advanced training. But there are other professions too that can help out. We've had 3 babies since Sunday that were born at home. And so that means that some of them also had doulas. One of our office manager, Megan, she's a doula, and she's able to attend these. But she's also gone through the spinning babies training. We've done some of that work together. And so she's also done Rebozo training. She's done a lot of advanced body work. And so it's a good question for you as a mom who's expecting to have a baby. We're sitting here in a very unique time in our history where hospitals are saying, well, you can only have 1 extra support person. What does that support person need to know how to do? Are you in a hospital situation where those nurse midwives know, hey, listen, let's put you into some different positions? Or are you in there with an obstetrician who has taken some of these classes and says, oh, probably sticking you on your back isn't going to be the best for you right now? Are you there with some other nurses who have done this kind of training? Does your hospital system have doulas that you have access to? All of this kind of stuff is definitely something that you should look into, whether it's in the hospital or at home, as far as who's going to be on your team. Ask these questions of your birth providers. Do they know what to do? Do they have activities that you can be doing during pregnancy and during the labor to help your baby move down through the different stations of the pelvis so that you can have birth the way that you want it to? Thanks a lot for making sure that you watch this One Belly Wednesday. Again, remember to subscribe to our YouTube channel. We have a Facebook page also, Mama's Chiropractic, and on Instagram TV. Our Mama's Chiropractic Instagram page is full of good information, really clever memes, things that Allison, our research assistant, puts together. And if you have any questions, as always, get in touch.